Welcome back to TV5 News at 9. Today we are talking with board-certified neurosurgeon, Dr. Jay Jaganathan. Thank you so much for being here. We're delighted to have you today, Doctor.
Thanks, Claude. Thanks for having me.
Of course, you're welcome. So we're talking about non-surgical options for back pain. First, tell us, what are some of the causes of back pain, Doctor?
There are a variety of causes. I mean, back pain is probably one of the top three most common reasons why patients visit the ER or their primary doctors. So the majority of causes are non-surgical. Most commonly, it's muscle strains or sprains. Other causes can be disc degeneration, which just means wear and tear involving the discs. In some cases, it can be severe pathology, things like fractures, like tumors, like large discs are compressing on the nerve.
Dr. J, I can't tell you how many people I know that have back pain and they just say, I don't want to have anything to do with surgery at all. But now you have some good news that there are some non-surgical options and treatments for back pain. Is that correct?
Yes, as I mentioned, I think back pain is a very common problem that patients have, and it's a major source of morbidity for patients. And the first line of treatment are always back pain. And the good news is the majority of cases, back pain will resolve without surgery. And the two mainstays for that are physical therapy, which mainly focuses on strengthening the muscles, particularly the core muscles, to help stabilize the spine, as well as in some cases interventional pain management, where you try steroid injections and things like that to relieve inflammation around the nerve or along the joint that might be inflamed.
Well, it's great to know that those options are out there. And tell us about minimally invasive spine surgery, Doctor.
So in cases where the so-called conservative or non-surgical treatments work, there are minimally invasive options where we can go in and clean out around the nerve. And then this takes advantage of advances in imaging technology, which allow us to pinpoint the location where a pathology is, as well as better visualization or magnification using the operating microscope, endoscope, and other technologies that allow us to go in and really focus in on cleaning out a nerve that might be pinched. So a minimally invasive option for many patients may be a good option, maybe where you can get equal relief with a quicker recovery and less less postoperative pain and discomfort.
Doctor, what would you tell someone if they think that this is a good treatment for them? What should they do?
I think ultimately the decision for surgery in the majority of cases is a quality of life issue. So we always recommend trying conservative management, meaning the therapy, the shots, things like that. If those don't work or someone feels that their quality of life is bad, usually what we do is we evaluate the MRI scan, see if the pathology in the MRI correlates with the patient's symptoms. And if it does, in some cases, surgery can be very effective in terms of treating that and can have a very quick recovery, which would minimize downtime and keep a patient active. But it's always a decision that's made in conjunction with the patient. It's never a black and white type of decision, and so it's one that needs to be tailored towards the patient's what they want to accomplish out of surgery and whether they want surgery or not.
Great, and you gave us some awesome information. If someone needs some more information and like to have some more questions answered, where should they go for more information, Doctor?
They can visit our website, www.mi-neurosurgery.com, or they're welcome to visit our office in Bay City and West Branch as well.
Well, we're delighted to have you. Thank you so much for calling in. We appreciate it, Doctor.
Thank you, Claude.
You're welcome. And you can find more information in the hot link section of WNEM.com.